So today we're going to be talking about our right heart catheterization, also known as our Swan-Ganz catheter. And so we're just going to go over all of these and kind of talk about the numbers and what they mean so we can make better judgments and think ahead of time when it comes time for rounds and things like that for our heart failure patients. So since this is the right heart catheterization, I'm going to take you through exactly how the catheter goes into the heart first, and then we'll talk about the numbers and the measurements we get. But just a quick review, so I have a heart drawn up here, and so this is going to be our right atriums right here. And then we have our right ventricle. And this is going to be our pulmonary artery. And so right here, it's going to come from the right ventricle all the way up through. And I'm just going to write it out here for ease of legibility and things like that. So these are going to be our main ones. And then for completeness sake, this would be, since it's mirroring the right atrium, probably the left atrium. And then on the other side, following our left ventricle, or our workhorse that we have basically pumping the blood throughout our body. So what happens in this procedure is you put a catheter usually in on the right side of the body, so through usually the neck or the subclavian artery, and it goes down and it goes in through our superior vena cava into the right atrium. It's going to go through our valve here into the right ventricle, then it gets snaked up through our pulmonic valve into our pulmonary artery, and attached to it, it has a little balloon here that sits there that can be pumped up, and we can get measures and things like that. So that's the basic process that goes in. So what numbers and things do we get from this? Well, get right along the way, we can get the RA, or the right atrial pressure. So we have the RA pressure is going to be the first one we get. This is also denoted in some cases if the patient is in the ICU and has the catheter in for a long time, can also be noted as the CVP. So the RA also can be called the central venous pressure, or CVP, because all of the blood enters through our superior and inferior vena cava, and that is the central pressure from our body. So what the RA pressure is measuring in millimeters of mercury is all of the blood that is going to enter the heart. There. All right, and so when you think about this, you would think that it'd be a big volume, but if you remember, our right side of the heart doesn't really do a lot with volume and things of that nature. So it's actually not that big of amount of fluid. In a normal person that's moving our blood efficiently throughout the heart, it's going to be something smaller. So thinking about that, you might guess that it's actually on the lower side, and a normal pressure was actually anywhere from 0 to 6 millimeters of mercury for something going through the RA. Now I'm going to skip over the RV. We often do get these measurements, but they're not as clinically relevant, and we don't do as much with them as besides getting them. So the next pressure that we can get is called a PA pressure. And so that stands for our pulmonary artery. And so that's going to be after the catheter is come down, goes up, and is sitting in there, but the balloon is not inflated yet. So it'd be sitting there kind of like this, not completely inflated, because when it's inflated, and we'll show you that later, it goes all the way up and matches around, pushes up against the pulmonary artery. So the PA pressure is something that we tend to use to kind of see how the right side is handling fluid, right? Because it's going to measure all of this back up. So when we get a PA pressure, we get it in usually 3 different measurements, and it's when the heart is contracting, so we get a systolic measurement. So I'm just going to abbreviate that as sys. And then we also get a relaxation measurement, so that'll be our diastolic, and I'll abbreviate it as DIA. And then finally, we get a mean of those numbers, so we get the average. And all of these are important, but really we make diagnosis and decisions based on the mean or the average. But a normal systolic is probably somewhere around 25 or lower, a diastolic around 10, and again, these are all in millimeters of mercury. And the mean, you don't want the mean to be greater or equal to 25, because that means that fluid is backing up on the right side of the heart, and we have something like pulmonary hypertension that we then have to deal with. So these are our markers to kind of assess the right side of our heart. We also get another PA measurement that's called the PA sat. So this is going to be the saturation level of oxygen that's occurring right in this middle artery, or right in the artery there. And so this is where right before blood mixes and gets to the lungs, right? So thinking about that, what might that actually be? So ideally, somebody's true PA sat is probably somewhere right between 60 and 70. Ideally, and this is in a percent, ideally closer to 70 is what we're shooting for in patients. Now you'll see patients with chronic heart failure that have affected the right side especially too, don't move fluid as well, so they don't oxygenate as well, might have in the low 60s to 50s and even 40s, and they're chronically there talking to you, and that's fine. Now the final measurement that we often get, or not, I shouldn't say final, but before some calculations that are done, is we get the pulmonary capillary wedge pressure. And so what that actually entails is when we go back to here, remember I talked about the balloon blowing up, so that's when the balloon blows up and we get this pressure here. And that is directly in relation to figuring out what the LA pressure is. So we kind of equal that to what the left atrium might be doing. And ideally, in patients, we would like them to be less than 15 is normal, but we kind of use 18 as the cutoff for being volume overloaded on the left side. And then, now, the final measurement is we also get, and come over here, the final measurement we get is we get a cardiac output and we get a cardiac index. These are markers of how well the heart is pumping. And so the average is at least, usually in a normal person, for our cardiac index, we often want 5 liters per minute. And you'll see it's often reported this way with a slash in between, CO / CI for the cardiac index. And a normal cardiac index, this way, and a normal cardiac index is usually somewhere greater than 2.5, if not higher, for these patients. And so that is a quick summary about a right heart catheterization and some of the numbers we get. And these are numbers that we use to really kind of decide therapy. So a quick reminder, so if the pulmonary capillary wedge pressure is greater than 15, then we know the patient's got volume on board, and we might choose something to do like diuresis. So that would be how these numbers are used in clinical practice.